Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is all about the basics of medication safety. As you all know, medication errors rank as the most frequent and avoidable sources of patient harm during entire treatment process of a patient's journey. Yes. Now I request all the speakers in the panels to introduce themselves. Yes, Etunde, over to you.
Thank you. Good morning, everyone from Nigeria. My name is Yetunde Olade. I'm a registered nurse. I work with Ladoke Akintola University of Technology Teaching Hospital, Ogbomoso, Nigeria. Thank you for having me.
Yes, we are also privileged and very honored to have you all in this platform. Yes, Ritinki, you would like to say?
Good afternoon, everyone. Thank you for the invitation for the webinar. I'm glad to be a part of this webinar. And my name is Rikinti Nongsid from Goldfinch College of Nursing. I'm an associate officer in Goldfinch College. Thank you.
Yes. We do have a speaker from Nanded. Yes, Tripti. Unmute yourself. Unmute yourself. Yes.
Good afternoon, everyone. Myself, Trupti Chavan. I'm from Nanded, in charge Nursery Ganga Hospital.
Okay, please do not keep unmute yourself. Do not unmute. We will be just able to hear each other. In case of any disturbance, you can mute. Yes. So going forward, this is a very interesting topic because we keep seeing a lot of challenges in the bedside in terms of medication error. Yes. So let us first understand what is medication safety as per Center for Disease Control and Prevention. Yes, Etunde, what kind of safety practice do you all adhere at your setup? Over to you, Etunde.
Thank you. Medication safety to me, and the way we practice in my own center is a process by which we ensure that the drugs that are prescribed by the healthcare provider are given to the patient in a possible safe method so that it will not cause any preventable harm to them.
Yes, very valid. As you said, when doctors prescribe the order, the nurse responsibility is to check before she administers. Yes.
Yes.
So the other definition or other concept we like to understand from Ritinki, what is this medication safety? You give this training to your student nurses. You would like to say something like yes.
Yes, according to the Institute of Safe Medication Practices, here they say that medication safety encompasses all the measures taken to assess the patient, to monitor the patient, and to prevent the adverse effects and complications of the patient in order to prevent the harm or injury to the patient. So here we have the 6 goals, as we have mentioned here: identify the patients correctly. So when we identify the patients, that means we should collect the full name of the patient as well as the middle name, the last name, as well as we have to compare with the tag of the patient. Then we also have this improve effective communication. That means especially the hand-off communication. We have to provide efficacy, accurate information to the other person who is receiving the information for the care of the patient, then as well as improve the safety of high alert medication. Here is very important because there are some medications, example like heparin, insulin, then warfarin, then any other drugs which are high alert, which are having the strong effects on the patient's health. Those type of medications we should not place near to the bedside of the patient. Never we place this type of medication at the bedside because they may take it or they may cause any other effects. So these type of medications such as look-alike medication or maybe sound-alike medication like dobutamine or the dopamine, the vitamin, this type of medication which is sound-alike, this type also we should have these tall lettering.
Okay, just a minute.
Marks.
We like to we like to understand from Etunde, like what term describes the absence of preventable harm to a patient, like during medication administration. What kind of terminology the nurses should practice? Like always,
Thank you.
heard. Over to you.
Patient safety is very important. So we have to do diligent cross-checking of the drug you have at hand. Most of the time, some drug ampoules and fire look alike, but they are not the same. So you have to check. You have to cross-check. You can even cross-check with another nurse on duty with you, or they provide anybody that is available. You have to verify that you are giving the right drug to the patient. For instance, now we look at the vial of vasopressin and other cetron. They look alike, but they are not the same drug and they don't perform the same function. So in order to ensure patient safety, you have to check very well to ensure you are giving the right drug to the right patient.
Yes. Yes, very valid point as Ritinki and you have said that look-alike medications poses a lot of threat before administration, the medication we got to check. Yes. Tripti, how do you cross-check your medications before you give to the patient?
Then check of doctor orders, then check of medication, or
Yes.
then check of preparation.
Yes.
etc.
So how do you check? Like, what do you say? Like 50 mg means 50 mg. How much is the ml? What is the route? Whether it
50
is expired, near expiry, all that?
near expiry, or check of
Yes.
duration.
Strength also we check, no? Whether it is 5 mg, 50 mg, 250 mg, single dose, double dose, all that we check, no?
1
Yes.
gram.
So, yes, going forward, like when we are talking about the main theme of this medication safety, which is nothing but the basics of medication safety, you know. So, what are the basics of medication safety we got to tell to all the viewers and nurses who are, viewing this webinar? Yes, Yetunde. What do you practice at your setup? Like, do you follow the WHO guideline or nowadays we have CDC guideline which talks about 10 rights? Yes, over to you.
Thank you.
Yes,
In
thank
my
you, Ma.
own facility, we follow the WHO right to drug administration, medication administration, the right patient, the right drug, right dose, right route, and right time. But in addition, I think the area that we need to put more focus on is right to educate. We need to educate the patient about the drug you want to give to the patient and what is expected of them and how the drugs works. Then also right assessments. There's some medication that you have to assess the patient before administering it to the patient. For example, now if you are in a medical ward and you are administering digoxin to a patient, the first thing is supposed to check the vital signs of that patient before you
Yes.
administer that drug. If the pulse rate is lower than 60, you have to withhold and contact the healthcare provider to let them know the situation on ground. And also right evaluation. Most of the time, even when you started the care, we need to check again. For example, for a patient that have hypokalemia, we are trying to do correction of that, and you already started the patient on potassium chloride infusion. The cost still the demand that you still have to check the vital sign, the blood check to check the level of the potassium of that patient to know whether we are stopping it or the patient potassium level is already normal, or the patient potassium level is still low, or we are now in hypokalemia, so that we're able to know how to take care of the patient. So it's very important. Right evaluation is very important. Thank you.
Yes. So, what kind of, like Rikinti now, do you think that all the rights have been practiced as Etunde was saying that right education, sometimes we miss the right documentation, sometimes we miss, sometimes right assessment is actually not seen. Like if a patient is on loop diuretics infusion, like Lasix infusion, what right assessment we got to give the one the patient who is admitted by the room side. Yes. So, and among this route, what is not been followed here? Right time? Do you think right time is followed, Ritinki?
I guess maximum of the nurses, they try to follow the right time, but then sometimes they do miss. They do miss the right time because sometimes there are situations when the medication was supposed to administer at 1 hour. Maybe sometimes they may be late 1 hour later, or maybe 1 hour earlier. So sometimes they may not be able to follow as per the prescribed schedule. So sometimes they do miss.
Yes, very right. And Tripti, do you give the medications on time, or do you
Then
just delay by half an hour or sometimes 1 hour, because nurse patient ratio also matters, right?
then incorrect timing.
आप टाइम में
Incorrect
देते हो
order
medication?
of
आप टाइम में देते हो medication,
क्या
like
मैम?
टाइम में देते हो 2 बजे का मेडिकेशन 2 बजे देते हैं कि कभी कभी
नहीं मैम,
थोड़ा सा इधर
कभी
उधर
कभी
डिले हो
छूट
जाता है?
जाता है। हाँ, तो देन इनकरेक्ट इन टाइमिंग, incomplete order checklist,
Okay.
unable or inaccurate patient information, faulting or obtain allergic history.
So this takes time. Okay, very good. Going forward, like yes, over to you, Yetunde, for your insight. Who all are responsible for medication safety? Yes, at your facility, your pharmacist you have. Do they mix the drugs, injections or medications? Yetunde. Okay, I think there is a connection problem. Yes, Ritinki, what do you have to say for this?
Yes, mom. Everyone who is working in the healthcare setup, especially the healthcare professionals like the doctors who are the main primary prescribers, the nurses who administer the medications, and the pharmacists who are preparing and dispensing the medications, they are all responsible for the medication safety of the patients. We all should be alert and we all have to do double checking. Sometimes triple checking also is needed by the high qualified personnel.
Very good. Yes. Etunde, at your setup, like at your, hospital, like, do pharmacy mixes the drug or the nurses mixes the drug? Yes. Okay, we may come back with Etunde because maybe yes. So what is this medication reconciliation means? Like as we were discussing, right? This is also one of the very important aspects. So what do you understand by medication reconciliation? Do you all practice, Ritinki? Yes.
Yes, ma'am. Medication reconciliation is very important because it is the process when we compare the patient's present medication orders to the previous one, which they took previously. So sometimes there are errors. Example, they had given here like current medication at home, metformin 500
Yes.
mg twice daily. So sometimes in the hospital, they had been prescribed like insulin. So sometimes there will be a shift of the medications at home as well as in the hospital prescribed by the doctors.
Yes. So this is very important whenever we receive the patient during discharge, during transfer in and initial admission state, we need to see what they are taking home prescribed medications and, and the current medication which is prescribed so that we do not, give the double dosage of medication. Yes. Going
Yes,
forward,
ma'am.
again, yes. How high risk medications to be handled? Yes, Etunde, can you hear me? How this high risk medication, high alert medications has to be handled? Like we see the category of high risk medications
Iris,
like,
Atropine,
yes,
adrenaline, nitrolone,
Iris
noride.
medication should be okay. Should be
yes,
handled with care, especially like anticoagulants or heparin, warfarin, insulin, chemotherapy agents, narcotic, opioids should be handled with care. So we need to verify, double checking because we want the patient to be safe because
yes,
any injury caused to the patient can be severe. It can even lead to
yes. So, as per the hospital policy and narcotic policy, the narcotic drug should be under double lock and key, and the shift senior or in charge only should handle. And before starting the infusion, we must cross check this infusion order from the consultant or intensivist and the senior nurse, and so do we have to administer. Yes. So, what are the common medication errors we get to witness? Like, Ritinki, when you go to the clinicals, when you mentor your student, yes, what are the common among, few I try to give here. What are the common errors the nurse is bound to do the mistake? Yes. Yes, Ritinki.
They,
Yes, ma'am.
then
Incorrect duration.
So what is a common error you get to see? Yes.
In also one of the most common
Okay,
because
we are
sometimes what
experiencing
the
again technical
desired
glitch. Just a
prescription
minute. Yes.
desired as being prescribed sometimes due to the incorrect calculations, due to inaccurate calculations, miscalculations, sometimes they may miss the dose, they may miss the strength. So sometimes it cause error. Instead of giving like 2 mg, sometimes they may miss extra than that or lesser than that. So sometimes miscalculations, especially in the drop factor, is one of the most common errors,
Okay, Tripti.
especially like
Yes.
those trainee nurses or freshers nurses.
Yes. So, Tripti, this is again over for you. Like incorrect duration means whatever you start, does it, over on time? What is incorrect duration? आप
इन
medications को correct time में खत्म कर पाते हो या नहीं?
कभी कभी तो नहीं होता है मैम.
Yes. क्यों?
टाइम मेडिकल कभी कभी रिलेटिव्स अवेलेबल करके नहीं देते टाइम पे मेडिसिन. कभी
Yes.
कभी इमरजेंसी पेशेंट आ गया तो स्टाफ उधर चला जाता है.
Yeah, distractions हो जाता है, नहीं तो nurses are busy with other activities, and some hospitals have attenders who gets the medications. Sometimes the patients are shifted to OPD for some investigation. So number of opportunities of disconnections, right? That is the
Yes.
reason when we are not able to correct the medications on time with the proper duration. Yes. So going forward, we are just nearing to the preventive steps. Like few preventive steps we all have to take care, like because medication is a kind of error and which will really cause a lot of harm to the patient. So double check is very important. I am sure that everybody does double check in case of high risk
Yeah.
medication and essential drugs as well. Yeah, yes, and clear handover bedside is very important. Nowadays, barcode technology is everywhere available in the, tertiary care centers and all. Like pharmacy also has a good concept of barcode scanning and technology. Clear handovers right from the patient medication. If there is a new medication prescribed, the morning or evening nurses, when they take over, they should see what is, prescribed. If it is indented and kept by the door, or sometimes it is a fridge drug, they should always verify what kind of medications they have received from pharmacy. Yes, and if at all they have any doubt, they should always check with the consultant as well. Seek, ask clarification in case of any doubt. And as everybody, we were just talking on job training, bedside is important. I think, yes, Ritinki, your nurses
Yes.
also, they get training.
Yes,
Yes.
ma'am. Yes,
Yes,
ma'am.
and Etunde, do you give on-job training bedside?
Yes, yes, we do that in my facilities. Eventually, for the newly graduated nurses that are just joining the system, you want to put them through so that I can bridge the gap between the practice
Yes.
and also the theoretical aspect so that they will know what is operating at the facility. So we do
Yes,
that a
very
lot.
well said. Yes. On-job training by the clinical bedside, because these high-risk medications cannot be handled by everyone. Like trainee nurses and the very fresher nurses cannot handle. They need to have opportunities of, loading this medication under supervision. When they are competent enough, then only they can administer under a few, opportunities of supervision. And we always try to tell all the nurses to report errors if they have,
Yes.
because these are non-intentional, non-intended errors, so they should always report the error so that patients are safe by, we can try to some prevention for the patients. Yes. So we have come to the end of the discussion. As we said, look alike and sound alike medications has to be, handled with care. So report errors before it turns into a sentinel event. Sentinel event is a very big term. I think it is a very potential danger when patient faces due to the medication error. So please go through what is a sentinel event. And with this, we end the webinar. And thank you everyone for your valuable support for this webinar. And share the link among all your nurses so that they see and they learn. We end the session. Yes. Thank you, Atunde. Thank you, Ritinki, and thank you, Tripti.
Thank you for having me.
Thank you,
Thank you, ma'am.
everyone. Thank
Thank
you.
you.
Thank you.
Thank you.